conversation is going round. People talking about the girls come to town. Fresh as a summer breeze, she'll take you by surprise.
Hi, this is Bren Masson, host of Freshwaves. Joining us online now, and I must tell everybody, this is Zoom. This is not really a telephone line, and we're not part of a large radio station that has $250,000 worth of recording equipment to make a telephone call sound like the person is actually sitting in the studio. So bear with us. We are on Zoom today as a result of the coronavirus lockdown, so to speak, social isolation. Everybody's staying at home and doing what they're supposed to do. So we are doing our Freshwaves interview via Zoom. And this is pre-recorded. Our guest this morning is Sandra Holdsworth. Now, Sandra is the past president of the Canadian Transplant Association, and she's still very active in that. And I'm going to let you introduce your title because, Sandra, I think it's the second longest title I've ever heard in my life. Go for it.
Good morning, Brenda. Thanks for having me on the show. Yeah, so as you said, I've been involved with the Canadian Transplant Association for over 20 years, and I'm their past provincial director. But today I'm mainly involved with the Canadian Donation Transplant Research Program. So CDTRP is the acronym, and I'm a patient partner with them. And I also do some volunteer work with Trillium Gift of Life. I run Muskoka Gift of Life Association up here in Muskoka. And and I help with Canadian Blood Services as well, helping them to promote organ and tissue donation. And we have a blood clinic here in Muskoka that we help facilitate volunteers for.
Well, I must say that during this coronavirus epidemic, you are in one lovely place to be socially isolated.
Yeah, a lot of people are heading up to their cottages. Yes, it's a very nice place to be. It's very quiet. There's not as many people. And it's nice. I do miss like everybody, my family and friends and that. But it's definitely difficult times.
Yes, I will give a little plug while we're on the topic that Muskoka, the mayor of Muskoka and the mayor of Haliburton have asked the public who own cottages not to come to their cottages right now. A flood or an influx of cottagers would put a really big strain on their grocery stores and things like that. Their ordering of extra food, produce, necessities comes in the summertime when they're expecting the tourist population. And right now, their grocery stores are there to supply the people who live there all year round. And in April, that's one of the slowest months up there. So an influx of people would really hurt their supply chain. So they're asking people not to come to their cottages, but to stay at home and social isolate at home, wherever home might be.
Yes.
Sandra, let's start at the beginning. You too are an organ recipient.
Yes, I received a liver transplant in 1997, 23 years ago. I'm very fortunate, and I've been doing amazing. And that's why I do all this. This is why it's my opportunity to give back, to say thanks to my donor, and to help all those others that are waiting on the transplant list. I'm also involved too in helping transform our healthcare, because you can imagine having a transplant and some of the other health issues I've had. I've seen a lot about how our healthcare works. So I also wanted to mention, when we were talking about Muskoka, is that I'm proud to say that Muskoka just reached a milestone. We now have all of our major towns are over 50% of registration rates. So Bracebridge is at 56%, Huntsville 52%, and here in Gravenhurst we're at 50%, which is fantastic. Yes, it's amazing. The provincial average is 35. Say the national average, like Canada-wide, is probably closer to like 28%, but Ontario's 35. We do
35, yeah. Well, I know the goal is to be 50%. Why wouldn't the goal be 100%?
That's my goal for Muskoka. Why not, right? But
Why not?
baby steps, baby steps. When I started this, believe it or not, Brenda, the registration rate in Ontario was 12%. When I
What?
first started
Wow.
promoting this, yes. I just found some of my old documents from
What?
2000,
Oh my goodness.
1999. Yeah, so we've come a long way. I don't think people realize. Only those of us who were there at the beginning, and when Trillium Foundation, Trillium Gift of Life Network came on board in around 2000, 2001. They really put in a lot of good process and procedures to help improve registration and help improve the transplant process, the donation process. So we are leading the way. And I got an email from Tony Belay. Well, it was a tweet saying, "Good for you guys for doing that in Muskoka with your registration rates without having me opt in." Right. So I'm a firm believer that people will register if we educate them and answer all their questions, and this just constantly remind them to register.
Yeah, I think one of the key things to the registration, from what I've seen in the people that I've been speaking with, is the connection to the people who have benefited from the program. It's one thing to say, oh, just be an organ donor, and then they have all these morbid questions, well, they're going to kill me first because, or they're not going to save me because they want my organs and things like this, which is just so not true. But also, once they see the people who the organ donation program has helped, when they see you, Sandra, and they see you, Jay, who I know, Jason is our technical producer here at Freshwaves, and I know he's in on the conversation this morning. And when you meet people like you two, you can't help but want to donate your organs, because if I'm going to die anyway, then my organs can help you or someone like you, someone like Robbie that we heard from last week, or Eric, or whoever. That's when organ donation takes on a face and a persona. And that's when you can't help but want to help.
Yeah, there's something I add to that. So the myths that you brought up is the education piece. So we need to answer people's fears, because people do have fear of death and dying, which we acknowledge. So we answer their fears. But you're right. It's showing those stories, sharing our stories. And actually, that's what the focus is going to be on, is a lot of my transplant friends and that are going to be wearing their green shirts and promoting Organ Donation Awareness Month. But they're also going to be posting videos of themselves or their loved ones. So if it's a daughter or the son who's had it, like a younger child, they're going to share those stories and that, so that we can put a face, right? That's what Logan Boulay was able to do. Logan Boulay was able to put a face to organ donation. And if you look at what happened 2 years ago with what we call the Logan Boulay effect, his death, because of, again, another tragedy, encouraged all those hundreds of thousands of people to register. And many of them didn't know him, but they could put a face and they could identify with, there's somebody who was a donor and he's a hero. I want to be like him, right? And
That's
then when you
exactly
start to see
that. That's what Logan did, because it was his fitness coach who passed away. But
Rick Suggett. Yeah, so
right.
he saw it and that, yeah. So there's two ways of looking at it. It's looking at people who they know that were donors, and then it's also looking at the recipients. And I do work with a lot of donor families, but I've also met many families along the way that have lost loved ones. And when they get to see the love and admiration that is shown to donor families, they're like, well, I had a loved one who passed, and I wonder why they could. So now they're starting to ask questions. And in a lot of cases, it was the families that approached the hospital staff about organ donation back in the day, right? So now, obviously, there's systems in place that it's regulated, right? If to notify Trillium Gift of Life if there is a death, and then they will help the hospital staff decide if it's appropriate. But yeah, no, and so it's these feel good stories and knowing. And the other thing I say about this is more than likely you will require a transplant than become an organ donor. And I said this probably 10, 15 years ago, that you will know somebody who's either had a transplant, is waiting on the transplant list, or you know somebody who was an organ donor, either a living donor or deceased donor. And I'm pretty sure that's happened right now. I think the majority of people can say that they know somebody who fit into that criteria.
3 or 4 years ago, when Jason brought this idea to mind, I thought, yeah, okay, we'll do a show. And we did one show. I can honestly
Yeah.
say that since meeting Jason, I have become more aware of this than ever before. But I still run into people to this day who put no onus on it whatsoever. It doesn't affect them at all. They've known no one who's donated and no one who's received. And when I start bringing to light these different stories, I mean, they have tears in their eyes.
Yeah.
When I first brought forth a question to one of our guests last year and said she actually, her 10-year-old son had passed away and she made the decision to donate his organs. And one of the people who was not familiar with this said to me, oh, well, I know a guy who got a heart and he only lasted for 3 years. What a waste of a donor heart. And this woman looked at me and she said, what I wouldn't give for 3 more years with my son.
Yeah. Yeah.
And that brings it home, doesn't it? It really
Yeah.
does.
And the reality is, Brenda, that person who heart probably only lasts 3 years is probably because he didn't get one soon enough.
Right. So he
All
was
right.
compromised. Plus, he was 70 years old by the time he got his.
Oh, okay. Okay. Well, there you go.
Yeah.
But no, but still, no. But there are people. I have friends in their 80s that still have transplanted organs. Right. I know a guy who's probably even getting closer to 90 with a heart transplant. So, yeah, no, it's those things that people really don't think about. It's because they don't. It's like they're not living it, but unfortunately, it will affect them someday.
I was just going to say, during those 3 years, one daughter got married and he got to meet 2 grandchildren. That's a pretty
Amazing.
full 3 years.
Well, I made a list of all the things that I was able to do. I mean, I had my transplant at 32, and I made a list of all the things I was able to do had I not had my transplant. It's huge and it's amazing. And it's a lot of family milestones. It's a lot of traveling. It's a lot of accomplishments. One of the biggest thing I'm most happy about is the people I meet in the transplant community. Jay can speak about this. Our transplant community is amazing. It's like, I joke, I joke and say, it's a high price of admission to join this club, but I wouldn't change my life for it, because the people that have had transplants, they just have such an appreciation for life. They don't put up with any BS. They call it as it is. They live their lives. They make the most of it, and they're just so full of joy. And I miss all the hugs. I miss all the laughter. I miss all the connections, right? And it's like, and it's an instant connection. It's like, as soon as you meet someone, it's like you've known them your whole life. It's very hard to describe, but and I look at, like, I've been around, as you said, 23 years. So I've lost a lot of people too, which is sad, because they get old, or they have something else that happens to them, a natural death, and sometimes they get viruses and things like that. But I would never change meeting those people. Like, whatever heartbreak I feel upon their death does not replace the joy I had in knowing them. If that makes sense.
No, it makes a lot of sense. And I can honestly say that as a person looking in, I have not had a transplant, but what I can honestly say is I've never met such a fun-loving, alive group of people. It's
Grateful.
just infectious to be around them. I mean, they have such a love of life and an appreciation. they don't take anything for granted. I asked Eric, so you wake up in the morning and it's just another day. And he said, no, I wake up in the morning and I breathe and I think, another wonderful day. I mean,
Yeah.
if we could all live like that, wouldn't it be a great world?
Mm-hmm. The other thing I wanted to mention about the times we're living in right now with the coronavirus, there's two things that have happened from it. First of all, the way that people are going out in the community, right? Like I would say majority of transplant recipients are staying in. But the way that the people are going out, like those who have to go out and go shopping and stuff, or they have something they have to go pick up, like medication, how cautious they are is how a transplant recipient lives every day. So the hand sanitizers, the not touching doors, the watching that people aren't sneezing, trying not to be around large crowds like anytime between October and December.
Except for
Just
Jason.
wearing. Yeah, yeah, but he's, in dialysis and stuff, and they protect it. And I have other friends that are on dialysis as well in the hospital, and they really protect it. But the point I'm trying to make is, though, this is the kind of way that we live on a regular basis. So actually, in a way, now that the general public is being more aware of this and how easily these things can transmit, one of the things that bothered me the most when I was trying to work is those who thought that they were being some kind of hero or bravery because they came into work because they were sick, and they're like, look at me, nothing knocks me down. But they would come in the office and they'd be sick, and you're like, well, thanks, because now you're making the whole office sick, and you're putting me at high risk of developing like pneumonia or something. You might get a cold, but I could get the flu, or I could get like pneumonia and stuff, right? So yeah, that's the one thing that's that I've thought about, right? So
Well, I think the coronavirus now will change that. The coronavirus is, now that everybody is aware of how vulnerable we all are, but specifically people with transplant or people who are immunocompromised.
yeah, that's another thing too, is because more people understand what immunocompromise means, right?
Yes.
Because I think there's a lot of the news people are actually explaining what does that mean, right? So, we think of the transplant community, but also people with heart issues or diabetes or COPD and, pardon?
Cancer.
Yes, all those people, right? So now they're starting to realize, it's not just the elderly. And yeah, so.
And it's an interesting way of living, because I think it's a much more respectful way, in so much as the coronavirus has been an awful situation on so many fronts. It's also increased our awareness of each other, of our relationship with each other, of our relationship in the world around us. I think it's really opened up a lot of eyes, and in many ways connected us in a way that we weren't connected before. I think people are more respectful of each other and more respectful of the people who are at risk, and it's all of us trying to take care of them. It's a different mentality than it was 6 months ago.
Yes, a big awareness. One of the things, like it was this time with the coronavirus, it was very difficult to decide about promoting organ donation or talking about organ donation awareness month. And the article that I wrote for our local newspaper that I shared with you, I focused on the
article, by the way.
Thank you. I focused on the fact that, Muskoka had done well, because that was a milestone that we had set up and that we had reached. And it was like a good news story for our politicians that had worked so hard to help us reach that goal. But it also, one of the things that I led into, and it came from the Boulets, because this is how they had they had had a talk with Logan in the backyard, I know that, but they're starting to refer to it as a kitchen table talk, and there was a painting that they received, and I shared that painting. And so I thought, one of the things that's happening right now is families that are at home. And I thought, well, what an opportunity to have the talk about, organ donation, but like one of the things, like, Canadians in general are afraid to talk about is death. And I'll tell you myself, I was afraid of death forever. I have an experience as a young child being in a church where, the priest told us we're all going to die and go to heaven. And it's like, you're 8 years old, all you heard was you're going to die. And then, and then you hear about Santa Claus, and it doesn't matter like how much money your family had, you still woke up Christmas morning and there was something underneath the tree. But like this whole idea of heaven and that, like, what's that like, right? So I had this fear of me forever. And it wasn't until the night of my transplant where a peace came over me, and I said, well, if it's my time, it's my time. And because I had to prepare for my death at such a young age, obviously I don't love death. I mean, I just lost my father last year, but I was able to spend the last 4 days of his life at his bedside. And I think it was the strength that I've gotten from being a transplant recipient and facing death in the face to say that it's okay. And so one of the things that I wanted people to talk about was what their wishes are. Like there are people like my dad, even though I tried to have the conversation with them, he still didn't answer a lot of main questions about what his wishes are. I knew he wanted to, if he could, be an organ donor, which he couldn't. And I knew he didn't, he was okay with cremation and that stuff. But, there's still other things that we could have had a conversation about. So I bring this up because it's an opportunity to talk about what your wishes are. So those of us that promote organ and tissue donation, we just want you to make a decision. So you have the talk, you get all the information, you make an informed decision. If you have any questions or those myths that you've heard about, you get the answers to them. You register, you tell your family, and then you just live your best life. And that's all we want, because we want those people registered, but more importantly, we want them to tell their family. And I think now is an opportunity to do that. Now is also another opportunity to get things in order too as well, because as a banker, I was so surprised at the amount of people that had children and owned property that didn't have a will. Right. And I bring this up only again because it goes back to the thing about us not wanting to talk about death. And, we're facing death right in the face right now. And so if we can turn death into a positive thing, right, and be able to save people's lives, then to me, I think it's a good thing to do.
Yeah, I think so too. I agree with you. I was warned before I started this show not to talk about coronavirus, and this may not be the year to talk about organ donation. Maybe you want to, talk about something else on Freshwaves. And I thought, nope, this is the year we have to talk about organ donation. It doesn't matter what year it is. We have to keep it first and foremost in people's minds. We have to keep people thinking about it, and to think about it in a different way. You have to think about, oh my goodness, in such a tragic, so many times, it's such a tragic situation, like the Boulets losing Logan. I mean, and the other boys that died in that crash. It was a devastating, horrible thing, and a horrible time for Canada as a whole. Yet throughout that, Logan inspired 200,000 people to become organ donors across this country. What a lovely thing out of such tragedy.
Mm-hmm. Yeah. So
that someone else can benefit from it. I mean, if you can just benefit even one person, you've done such a good thing, You're listening to Fresh Waves. I'm your host, Bren Masson. This morning we're speaking with Sandra Holdsworth, former president of the Canadian Transplant Association, and she's currently with the Canadian Blood Services. We'll be right back, so stay tuned. Hi, this is Bren Masson, host of Fresh Waves. This morning we're speaking with Sandra Holdsworth about organ donation awareness. This is Organ Donation Awareness Month. Make sure you go to beadonor.ca and sign up to be an organ donor today. Now back to the show.
And also organizations too that like Canadian Blood Services, who nationally looks after organ and tissue donation. They're really working hard. Well, first of all, there's still really a need for blood. So the Prime Minister announced it today, and we give a shout out to those of you people, those people who are donating blood, because anybody who's still going into the hospital for regular reasons. It's not just coronavirus, and I'm worried about the people that are in car accidents, or God forbid, like they're cutting themselves. I think that's another reason why we didn't want a lot of people coming up to the cottage. They're working outside, they're putting themselves at risk of falling or hurting themselves. I'm even with my husband, like, okay, you go out in the garden, but like no chainsaws or no cutting down trees, please, right? But so there's a need for blood. And they've done their campaign on organ and tissue donation as well. But what they're working on is the people who have survived coronavirus. They're trying to see if they can use them to donate their plasma and make a plasma to see if that can be help treat those with it. So all the people who are in research, and me being involved with research, we're looking at what we can do now. So it's all hands on deck for researchers to figure out what's going on with this virus, to find a cure. But we're also doing research at another level, like a clinical level, where we're finding out how transplant recipients are adjusting to the coronavirus, so how they're staying at home. We're doing a study on those who have pets, and how pets might are beneficial to those that are at home and that. So we're looking at different research like that. Really concerned about the mental health issue of everybody, right? Not just our transplant community, which was already there and wasn't really being fully addressed, but everybody's we're concerned about, right? So research is going on, and bringing back about Canadian Blood Services. They're also very, very cautious, and they always have been, about the safety of their products, but now the safety of their donors. They have all the chairs are separated, and only so many people can go in at once. But and unfortunately, our blood clinic got canceled because the local place that we do it at, the YMCA, was closed, right? So just wanted to give a plug out for blood donations.
The snowball effect that people don't understand. Yeah, sure, you want to go and give blood, but if the place that you normally go to has been closed, now what? And the ramifications of all the things that are going on for COVID-19, it's you don't think of how it affects people down the line. And I like what you were saying about being careful of the mental state of people who've had to practice social isolation. Jason, you're having to take precautions at home. How does it feel to be in social isolation? Because for you, it's almost what they originally called physical isolation. It's basically a physical isolation, because you really can't be around other people.
Oh, definitely. I mean, I live with my sister. I have my own separate apartment in this house. I live with my sister, my brother-in-law, and my niece. And when it comes to like doing family dinners, and with Easter coming up and stuff like that, it's we don't get together at the kitchen table to do dinners. So when dinner's ready, my sister will make it upstairs and bring it down to me and leave it outside my apartment door. So, and whenever she wants to talk to me or whatever, she'll keep her distance, and she's quite worried about getting me sick, so she'll have a mask on, and like we're sitting outside yesterday, and I it's great to get outside and have some fresh air, but still, keep our distance. So I try to, keep the connection with my niece and my family and stuff like that. But yeah, it's tough that I can't hug my own sister. We can't do our family dinners together. And Easter, yeah, that's going to be different, this year. So, with all that I'm going through, that, yeah, there's really a worry that, my sister doesn't want to get me sick, and I don't want to, compromise her. Like right now, my sister's the one that's doing the grocery shopping in the house, and I know she's taking all the precautions to keep herself safe and not to, bring any infection inside the house. So we try to do the best we can.
Okay, and Sandra, how about you? How do you find the social isolation, which is in fact a physical isolation?
I've been sick for many times, so I'm used to being at home sometimes for a long period of times, either recovering from my transplant or waiting for a transplant or after my surgeries and stuff. But I'm keeping busy. My husband and I are here in the house, so he does the grocery shopping. I don't see anybody. I've had no interaction with anybody other than him. I am organizing my stuff, so that's good. An opportunity to clean up and do some spring cleaning. I do miss my family, but I have a hard time because of my mom just losing my father. She's having a hard time, so I talk to her on the phone all the time and reach out to friends and do some Zoom calls with some friends and that. But it's okay. It's been like a month, but I think maybe after 3 months, it's going to get hard. So today we'll go for a drive, right? And then every so often I step outside and get some fresh air and walk up and down my driveway to get some exercise. But it's tough, but I know people have gone through worse than what we're going through right now. So I look at it like that.
Yep. Stop your whining. Just get on with it.
Yeah,
exactly.
we have like electricity, we have a house, we have food, we're not like other soldiers or,
yes. Well, that's what my pet peeve about this new slogan of stay safe, everybody, stay safe. We are safe. What we have to do is stay healthy, but we are safe. We're safe in our homes and we're safe. We've got food to eat, shelter, water. We are safe. This isn't an earthquake. This is a virus. We need to stay healthy, keep our immune systems up, keep people who are at risk safe, like you, keep you away from people. And Jason, keep you away, as hard as that is, because I'm used to seeing you every week. And
right
now we just talk on the phone and I say, Jason, get gloves. And you say, okay.
Of course, I got to follow orders here.
Well, Sandra's going to tell you to wear gloves, please. Wear gloves to protect yourself.
Face mask. Oh yeah, no, I leave the house with a face mask.
Yep, and put those glasses back on.
That's a good point.
Sandra, you had some other things that you wanted to speak to us about this morning, and I'd love to.
Yeah, I wanted to talk about how we can start working on some of the towns in York Region that are really, really, I'm going to call them out, not doing great when it comes to organ tissue donation registration. So I will give kudos to Witch Church Stouffville. That is at the provincial average of 35%.
Yeah,
that's great.
And to my hometown of Aurora, that's at 30. Shout out to Newmarket, 31%, which East Gwilberry, 31%. But what really bothers me is why places like Richmond Hill, Markham, and Vaughan are at 16 and 17%. That is unacceptable. It's very unacceptable. It's less than half of the provincial rate. So, I was born in Aurora and I was born in Richmond Hill, so I have a connection to it. And I'm involved with York Region Gift of Life that Jay's a member of. And I think that that's where we need to focus on. So I did tweet out to these, the mayors there and the MPPs and stuff. Now, it's like they didn't respond, but that was a start. But yeah, it has to be a focus. We have to find out what's going on in those communities. So now I guess because it's the focus right now is on the coronavirus, but we will definitely try to find out what's going on in those areas and start to focus on them. And so if that means us hosting more events in those areas, then that's what we need to do.
Mm-hmm. Do you think it's a matter of people just not understanding what organ donation is all about? I mean,
somebody mentioned to me that they might consider that there's a lot of like immigration there and that, but I mean, there's also, I don't know, like Richmond Hill, Oak Ridges isn't far from Aurora, right? It's just like, I mean,
it's
Oak Ridges
literally
is
down the
basically,
street.
yeah. So, and they have they have hospitals there. Yeah, and I mean, the Markham Stouffville Hospital is known for doing well with donation side of it, right? So, yeah, I've got to figure out what the reasons are behind it. Then we'll have a plan. So, probably connect with Children Gift of Life to see if they have any insight. But that was one of the things that I was saying. If we're going to do something, we want to go where it needs the attention.
Mm-hmm.
Right? So we wouldn't really go in Stouffville. I mean, you guys are covered. We were trying to do some stuff in Aurora and Newmarket, but I think we just need to continue our efforts there. King City, right? All the smaller towns do really well. But it's those three areas. So that would be my next goal, to talk to the people from York Region Gift of Life to say, hey, what can we do?
Right. And I would be curious to know what other municipalities in Canada are exhibiting populations of similar size, yet with the low registration as well, and compare those communities and find out what the similarities are and what we can do to boost the registration rate. I mean, it would be curious to find out what Barrie's registration rate is.
Barry's is like 46, I think.
Wow.
40.
Well, that's really good.
Yeah.
Then Markham,
Yeah.
Markham and Vaughan have no excuse. They've got to get on board. There's something wrong in that demographic that's not allowing them to be organ donors, unless the majority of the population is under the age of 16, which, is kind of highly unlikely.
Yeah. We'll have to figure that out. Now, I'll have to check out Barry's registration rate, but I definitely know that it's high 40s. But we have a group there too, and we're also very active with the mayor. And fortunately, almost all of our events have been canceled this month, but we've done a flag raising with them, and I always had full support of the mayor there. We've had the MPPs there, so we've had really good support, and that's what's required.
Yeah.
So I think, and the person I reached out to was the MP for Vaughan, who's actually the new mental health leader for the new mental health initiative. So yeah, start with the MPs, the MPPs, and then the mayors, and then just see what we can do and figure out what's happening.
Yeah,
because they're even lower than
or something. Have
Pardon?
the mayor of Stouffville reach out to Frank Scarpitti from Markham and say, hey, we've got 35%. I challenge you to bring your numbers up to ours,
Yeah. That's what I did with MPP. So when I grew up in Aurora, I lived out in Durham Region for 10 years, and then I moved up to Muskoka, and I did a challenge between the three communities. Ironically though, they were, they're all MPPs that I worked with, and they're all very active in promoting organ and tissue donation. And they're all doing well, actually. So, because Durham Region's doing great, Muskoka, and Aurora Newmarket's doing great. That was where the other MPPP was from.
Just for the listeners who have tuned in and may not know, I think everyone's pretty familiar with what organ donation is. What is tissue donation?
So tissue donation is mostly referred to as the cornea of your eye. It's skin, it's tendons, it's the heart valves, so it's the tissue parts, right? So visualize it. Yeah, mostly corneas referred to as tissue. Skin is a big one, like for fire victims and that. So yeah.
Interesting.
And that, it makes up a lot of the donations.
All
can
right.
enhance 75 people's lives, one donor.
Okay. So how would you suggest that the average person, I mean, we talked about the kitchen table conversation with our own families, but at this time when people are faced with so much death around them, how do we promote organ donation registration during this sensitive time? Have you got some wording that would resonate, or something that you would say if you were talking to someone right now and they're feeling very vulnerable? What would you say?
Well, if it was your family member that was in need of an organ, right?
Mhm.
Would you not want to have that person's life saved? And if that required somebody registering, would you not do the same thing? Right? So you got to put yourself in the footsteps of people like, Jay, who's waiting for a kidney transplant. And it doesn't affect it. There's babies in the hospital right now waiting for organ transplants, right? It's organ donation is not, it's not biased. It's not based on religion or sex. It's like, it doesn't matter what age you are, what sex you are, what religion you're from. If you have diabetes or COPD or heart failure or liver disease, that it's going to shut down your organ, and the only thing that can cure you or save your life is a transplant, then we need those opportunities to do that. And the reality is, unfortunately, we're all going to pass, and we obviously we don't want people to die. That's not what we are talking about. But when you do die, then then it's a good opportunity to be a hero. You're saving people's lives, right? So, and so when I talk about myself, people might say, well, you're only talking about this because you benefited from it. As I said earlier, I was prepared to die, but I figured, like, if there was an opportunity to save my life, then why not? So the way the world works, someone passed away and their family made their decision, and yes, I benefited from that, but I'm also doing my best to get back, right? And most people who do receive transplants are active members of the community, doing their best to make the world better and trying to improve the system and make opportunities for other people as well.
And you do give back so much, and I have to thank you for that. You do a wonderful job, and you have not sat still since your transplant. You are a
Oh no.
very active person. You really
I
do.
blame it on my donor. I said my donor must have been a chatter. My donor must have, because I literally laughed. No, I'm not laughing. I was literally trying to talk 3 hours after my transplant and trying to get them to pull out the tubes, like at 8:00 at night. The ICU nurse just couldn't understand it. She's like, I never get to talk to people. And she says, and I went back to say hi to her the next week, and all the other ICU staff was like, who's that? Who's that? And they said, oh, that was one of our transplant recipients. And they're all like, oh, wow. Like, and they were so lucky because unfortunately in the ICU, they see a lot of death. They don't see the success stories. And, there's proof right there, the difference it made to that ICU nurse and all the other staff that were around that saw this person walk back into the ICU and say, thank you, you saved my life, and here I am today. We need to do that more often.
Yeah, that's a great thing, and I'm glad that you were able to do that. All right. Well, I would like to say thank you very much, Sandra, for speaking with us today. We do this only once a year, and it's kind of like a family gathering now. I find that we have the same people on year after year. We hear different stories from recipients and donors, but the people who are in the administration and in the front lines working like you, we hear from you every year. I think that we should say, let's not make it once a year. Maybe we should hear from you again in the fall. And
that works for me.
we have Thanksgiving in the fall, and a lot of
Yeah.
fairs where there's a lot of people around, And maybe we do need to have tables out there at the country fairs where organ donation can be spoken about, and registration can happen, and you know, people get a chance to meet you guys and shake your hands and say hello. Well, maybe not shake your hands this year, but at least, you know, figuratively shake your hands. And
That's a great idea, fall
put a
fairs.
face to the people. I mean, one of the most incredible things for me is watching a woman walk into our studio, getting to know her through the course of a 2-hour interview, and she's a double lung heart transplant recipient. Holy mackerel! It's eye-opening, it's inspiring, it's heartwarming, it's all of these wonderful superlatives that I could go on forever. You know, I will run out of superlatives before I run out of the desire to keep saying how incredible these people are. They're just amazing. And I think if more people saw the benefit of being a registered organ donor, there would be more people signing up.
Yes.
So let's talk to you again in the fall, and let's have this conversation before we get into Thanksgiving and the holiday season.
Sounds good.
Okay.
Thanks a lot, Brenda, and thanks for your radio station. Thanks to Whistle FM.
Sandra, I hope that by the fall, you and I can actually sit in the studio together again and have
You
this
know what?
conversation.
I will get myself out there.
Okay, sounds great.
I'll make a promise.
Thank you so much for being a part of the show.
Thank you.
And thanks for your
care,
ongoing
Jay.
support.
Thank you, Sandra, for joining us.
Yeah,
no problem.
take care,
My pleasure.
Both of you, stay very safe, please.
Okay. Yeah, I will.
We sure will.
See you later. Thanks again.
Bye-bye.
And healthy.
For sure.
Very healthy. Yeah. Okay. Thanks for joining us today. You've been listening to Freshwaves, and this is our Organ Donation Awareness Month series. If you missed any part of the interview or you'd like to hear these stories again, go to our website, freshwaves.ca, and listen to all the stories of both organ recipients and donor families, and the people working the front lines in the Trillium Network, as well as Sandra, who is, of course, a part of the Transplant Association. Thanks for joining us today on Fresh Waves, and stay tuned for more interesting and exciting episodes of Fresh Waves.